Hello, everyone. It's Dr. Breen. Thank you for joining me today. I wanted to talk today about something that's very common, ear infections in children. So obviously we see an increase in ear infections this type of year because ear infections are caused by inflammation of the eustachian tube, which then causes the eardrum itself to become red and painful, and which is what causes your child to have symptoms. So the American Academy of Pediatrics estimates that there are about 5 million cases of acute otitis media a year in the United States, resulting in 10 million prescriptions of antibiotics written and over 30 million patient encounters. So obviously this is one of the most common reasons that children go to the ER, the doctor, or urgent care, or the clinic is because of ear infections. And so, as we sort of alluded to earlier, the reason children are more prone to ear infections is because their ear canal, their inner ear, the eustachian tube, is more horizontal and it is shorter and is of less diameter. So children are more prone to getting infections there. So in general, what happens is you'll get a viral illness that will cause lots of congestion, coughing, and then all that postnasal drip will drain to the back of the throat. The inner ear also drains into the back of the throat. So that little opening in the back of the throat where the inner ear drains the back of the throat will get swollen. It will narrow. And so that will cause the normal secretions from the inner ear to back up and get infected. So what we generally see is a swollen, inflamed eardrum. So it generally will look red. Or sometimes if it's just straight fluid behind it, it might have a little bit of a greenish color. We'll see when we're looking at the eardrum that the light reflex may not bounce off of it like normal. So normally when you look at the eardrum, it's a shiny gray. And when you look at it with the light in the ear, you'll see the light kind of bounce back toward you. And so if there's fluid behind the ear, generally we won't see that. That'll be lost of the light reflex. You can do, there are tests where you can use a little cuff to spray a puff of air in the eardrum to see if it's mobile or not. Don't really see people do that much anymore. I don't really feel like it would change the management. Obviously, the management of otitis media is with antibiotics. Generally, in children under 5, you treat with antibiotics for 10 days. Generally, first amoxicillin is the first line. And then if you need alternate treatments, if you're penicillin allergic, such as ceftonir or zithromax or clindamycin, some other antibiotic options that can be used. The most common organisms are bacterial superinfections upon a virus. So generally strep pneumonia, non-typable Haemophilus influenza, or Moraxella catarrhalis. Resistance does occur. About 10 to 20% of children will require a change in their antibiotic prescription or a longer duration of antibiotics. And so generally how the kids present with this is, like I said, they'll start complaining of ear pain after they've had a viral upper respiratory illness for about 5 to 7 days, usually fever. They'll be irritable. They won't be sleeping well. A lot of times they'll pull at their ear, but some of the subtles can just be, like, symptoms can be more subtle, like I said, just fussiness, not sleeping, or things like that. Obviously, I've seen thousands of children with ear infections over the years. I would be happy to see your child with an ear infection as well. Breen Medical is now open in Salisbury and Stokesdale. Please give us a call or visit breenmedical.com for more information. Our number in Salisbury is 704-216-1263. Our number in Stokesdale is 336-560-6033. Again, we're happy to see sick children with any illnesses over the age of 6 months old. But like I said, ear infections are one of the most common infections that we see, and we'd be happy to take great care of your child. Anyway, hope you have a great day. Hope you learned a little bit more about ear infections, and hope to see you soon.